This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the show. Dave Wilson with you. Our guest this morning is Dr. Ghulam Abbas. He's Director of Thoracic Surgery, and we're going to get into thoracic oncology today as our topic of discussion. But first, please welcome in Dr. Abbas to the program. Doctor, good morning. Good to have you.
Thank you for having me.
Appreciate you coming on. We'll get into the subject at hand in just a couple of minutes, but first we'd like to get to know our guest as we always do. So, Doctor, tell us about your background, where you're from, where you went to school, and how you ended up with Mon Health.
Yeah, I did my training in New York. I did my general surgery training, and then I went to Rush in Chicago for my cardiothoracic surgery fellowship. And after finishing my fellowship at Rush, I went to UPMC, University of Pittsburgh Medical Center, and did a 1 year of advanced training in minimally invasive thoracic surgery in 2005 and 6. And then I stayed as a faculty at UPMC for 10 years. I was the Department of Surgery chair for one of the tertiary care hospitals in the UPMC system for 10 years. And then I was recruited to be the chief of thoracic surgery for West Virginia University, WVU, and I was practicing at Ruby Memorial for 6 years as a chief of thoracic to help them build the program there. And then I was recruited to Vandalia Health to develop a thoracic surgery service line for thoracic oncology for CMC and Mon Health. So I will be mostly working at Mon Health.
So how long have you been with Mon Health then? It sounds fairly recent.
Yeah, I left WVU about a year ago, and I was mostly in Charleston. Now I'm starting in Mon. This month is my first month in Mon.
Well, how do you like the surroundings? Well, you've obviously been in Morgantown for a while, but how's it going with Mon Health so far?
Going excellent. Cannot complain.
So I said we're going to get into thoracic oncology. Can you just give us a general idea when we talk about, obviously, oncology, we're talking about cancer, but thoracic oncology in particular, what are we talking about there?
Yeah, so thoracic oncology means any kind of cancer or tumor in the chest cavity. And most common, obviously, is the lung cancer, but you get cancer of the food pipe, which is esophageal cancer. You get cancer of the mediastinal tumors like thymus gland, thymoma, other mediastinal tumors, chest wall tumors. But the most common still remains the lung cancer. Unfortunately, we are one of the highest incidences of lung cancer, and we have highest mortality associated with lung cancer. We are in the nation second in the incidence of lung cancer. God bless Kentucky. They keep beating us on that. But still, Kentucky and West Virginia are either number one or number two in the nation for lung cancer. Most of the lung cancer happens in patients who are smokers. And we now have lung cancer screening program for high-risk patients, which are patients who have smoked for 20 years or 20 pack years and age of between 50 and 80. They're eligible to get a low-dose CT scan every year. And it has been shown that patients who get low-dose CT scan among these high-risk patients who have been smokers, it decreases the mortality from lung cancer by 20%. So at Mon, we have this screening to cure system in place for lung cancer where we do lung cancer screening, we go ahead and do robotic bronchoscopy and biopsy of the cancer, and then we have a robotic lung cancer surgery program, and we call it a lung sparing surgery, where we remove only a segment of the lung which had the cancer, which has been shown to have the same survival as you do, but remove most of the lung. So we specialize on that. So that's the most common thoracic oncology. Then we have esophageal cancer. We'll talk more about that. And then we have the mediastinal tumors, which are thymoma, which arise from the thymus gland, and then we treat that. So thoracic oncology is a multidisciplinary system, is a team sport where a medical oncologist, radiation oncologist, thoracic surgeon, radiologist, pulmonologist, they all get together to take care of any thoracic cancer patients. And the role of the thoracic surgeon is to remove that cancer after chemotherapy or be without chemotherapy, depending on the stage.
You mentioned lung cancer being the most common type of thoracic cancer, and you mentioned West Virginia's very high rates of thoracic cancer. Is there a reason there, or is there an obvious correlation between our high thoracic cancer rates here in West Virginia and the cause?
Yes, sir. We are highest in smoking, adult smoking, highest in West Virginia and in the nation. And I think that's with exposure to coal mining and other industrial factors that lead to the highest incidence of lung cancer in the nation. So smoking, coal mining, and other environmental factors play a role.
Dr. Ghulam Abbas is our guest this morning, Director of Thoracic Surgery at Mon Health. And when we come back on the other side of the break, he mentioned esophageal cancer. April is Esophageal Cancer Awareness Month. We'll get into that subject as soon as we get back from this quick break. You're listening to Mon Health Talk this morning on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Ghulam Abbas, Director of Thoracic Surgery. I mentioned before the break that April is Esophageal Cancer Awareness Month. And Dr. Abbas, talk about the risk factors and symptoms of esophageal cancer that we need to be aware of.
So esophageal cancer is a deadly cancer. It is the sixth leading cause of all cancer-related deaths in the U.S. We have seen a 500% increase in the incidence of esophageal cancer in the last 30 to 40 years. And we associate that with lifestyle changes, increased incidence of reflux disease, and increased incidence of obesity in the United States. 76% of all esophageal cancer happens in Caucasian males aged 40 to 70 years and overweight. It's 5 times more common in male than female. Usually it's a progression of a chronic disease. Patients who have a long-standing reflux disease, they slowly build into, we call it esophagitis, which is the inflammation of the esophagus, and that continue to progress into a precancerous condition called Barrett's esophagus. And that ultimately leads to esophageal cancer, which is usually 85 to 90% of time is esophageal adenocarcinoma. The most common symptoms patients who develop esophageal cancer are difficulty in swallowing and weight loss. These are the most common symptoms. But patients who have early stage esophageal cancer or precancerous condition will mostly complain of reflux, heartburn, and maybe pain on swallowing and eating. So that's the earliest stages, but that can be just reflux disease. Once this cancer develops and it's caused blockage of the food pipe, then you develop a difficulty in swallowing.
So what treatment options are available?
So as I said, it's a progression of disease from reflux esophagitis to Barrett esophagus to adenocarcinoma. So at Mon Health, we have a comprehensive esophageal center where we can intervene in each phase of the disease. If a patient has severe reflux disease, the gastroenterologist and the esophageal surgeons treat the patient with lifestyle changes and medication. If that doesn't work, which works in 70% of time, 30% of patients will need an anti-reflux surgery. When, God forbid, it progresses to precancerous condition, which is radiofrequency ablation, which is Barrett esophagus, we treat it with either radiofrequency ablation or endoscopic resection or cryotherapy. So that's the treatment for precancerous condition. When it develops into esophageal cancer, then we proceed, if it's still early enough, we proceed with a robotic esophagectomy where you remove the esophagus and bring the stomach to substitute for esophagus. But if it's a locally advanced where the patients have difficulty in swallowing, then the multidisciplinary teams take care of the patient, where we give chemotherapy and radiation therapy first, then we do the robotic esophagectomy, and then we treat them with immunotherapy after that. So that's for the locally advanced esophageal cancer.
Are there steps we can take to reduce the risk of esophageal cancer?
Yes, so esophageal cancer, as I said, is very much associated with lifestyle. Patients who have severe reflux, they have to take steps which will reduce the reflux symptoms. They will have to eat healthy, lose weight, and all these good lifestyle changes will decrease their reflux symptoms and incidence of esophageal cancer. Patients who have Barrett esophagus, who are already in the precancerous condition, they should seek ablative therapy for reversal of the Barrett esophagus, which include either radiofrequency ablation, cryotherapy, or endoscopic resection. So these are the steps needed to. If patients have severe reflux, they should have been seen by a gastroenterologist and get endoscopies to make sure they're not developing precancerous condition or esophageal cancer.
That number, I wrote it down. You said a 500%. You've seen a 500% increase in incidence over the last several decades, and you attribute that mostly to, you've talked about lifestyle, diet, exercise, obesity. Those are all contributing factors to that enormous increase in incidence?
Yes, sir. That's true for the Western world, including Europe and U.S.
Oh, unbelievable. Talking to Dr. Ghulam Abbas this morning. He's Director of Thoracic Surgery at Mon Health. We'll take one more break, and we'll continue the conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Ghulam Abbas, Director of Thoracic Surgery at Mon Health. And Doctor, what do you want folks to take away from our conversation today? Doctor, what do you want folks to take away from our conversation today?
I think the key thing is that thoracic oncology, the common cancer, the lung cancer, and the esophageal cancer are strongly associated with lifestyle choices we make. Smoking is definitely, smoking is it's like you hiring an assassin to come and hurt you. There's no advantage of smoking, and it leads to lung cancer. Esophageal cancer, on the other hand, is associated with reflux disease and obesity. So having a healthy lifestyle, I think, improves and decreases your chances of getting these cancers.
It's amazing to me. I've done a lot of these shows over the last couple of years, and whether we're talking about talking to a thoracic surgeon or a cardiologist or a nutritionist, there's this common theme that remains throughout, and it's quit smoking or don't start, one or the other. Watch your diet, try to eat healthy, and get some exercise, and that is going to just have a tremendous overall positive impact on all aspects of your health.
Absolutely, sir. That's very well said.
Where can listeners go to get more information about services offered to treat thoracic cancers at Mon Health?
I think the information is available online, monhealth.com/cancer. Or they can call the Cancer Center in Mon Health, or just the general number for Mon Health.
And, Doctor, for folks, especially the esophageal cancer, if you're having acid reflux or persistent heartburn, is that a conversation you needed to have sooner rather than later with your primary care physician?
Absolutely, yes. I think if your symptoms are not going away with lifestyle changes, you should discuss it with your primary care doctor and maybe have a referral for GI to have an endoscopy done.
Dr. Ghulam Abbas, our guest this morning. Doctor, we appreciate you coming on, and we'll hope to speak again soon.
Thank you very much, sir.